Hi everyone, our lecture today is about the muscles of facial expression. As you can see in this picture, these are two bellies of the frontalis muscle. We have to know the origin, the insertion of this muscle, and also the nerve supply. This muscle originates from the skin and superficial fascia of the eyebrow, while the insertion of this muscle is to the gallia aponeurotica. Now we have to know the nerve supply of this muscle. This muscle supplied by the temporal branch of the facial nerve, which supply the motor innervation for this muscle. Okay? Now the actions of this muscle is by first raising the eyebrow, also make the expression of surprise, and also make wrinkles in the forehead region. Now we will see the actions of this muscle by one of our students in anatomy class, as you can see in this short video. This is raising the eyebrow, also make wrinkles in the forehead region, and making the expression of surprise. Now we will talk about the orbicularis oculi muscle. This is the sphincter muscle for the eye. This muscle consists of two parts. The largest and the thicker one is the orbital part. The orbital part originates from the medial palpebral ligament, and the insertion is to itself. It encircles the orbit or the eye to back to its origin. Okay, while the palpebral part, it is the thinner and the smaller portion of the orbicularis oculi muscle. It originates from the medial palpebral ligament and the insertion into the lateral palpebral raphe. The nerve supply, the motor innervation of this muscle is through two branches of the facial nerve. The first is the temporal branch of the facial nerve, which supplied the upper portion of the orbicularis oculi, while the lower portion of the orbicularis oculi supplied by the zygomatic branch of the facial nerve. Now we will see the action of this muscle is closing the eye forcibly. If we close the eye forcibly, then the orbital part is worked, while if we close the eye slightly, as in case of sleeping, the palpebral part is worked. Okay? Now we will talk about the orbicularis oris muscle. This is the sphincter muscle of the oral orifice. This muscle originates from the maxilla and the mandible at the midline, and also from the skin around the oral orifice. It encircles the oral orifice. The nerve supply of this muscle is through the buccal branch of the facial nerve. The action of this muscle is to close the mouth forcibly. Now we know the origin, the insertion of this muscle, the nerve supply, and the action of this muscle. This is the sphincter muscle for the oral orifice. We will see the actions of this muscle in the short video later. As you can see, this is closing the mouth forcibly. This is the action of orbicularis oris. Now we will talk about the vaccinator muscle. This muscle originates from the maxilla and the mandible, from the alveolar process of maxilla and mandible at the molars region, and from the trigomandibular ligaments. The insertion of this muscle anteriorly to the orbicularis oris and to the lip. This muscle acts by pushing the cheek against the teeth, as in blowing or in whistling. This muscle innervated by the buccal branch of the facial nerve, which supply the motor innervation to this muscle, where the sensory innervation to this muscle or to the cheek and the underlying lining of the cheek is by the long buccal nerve, which is a branch from the mandibular division of trigeminal nerve. This muscle action by pushing the cheek against teeth, as we said previously. We will see the action of this muscle in a short video. As you can see, this is our stopping action. This is the action of vaccinator muscle. Okay. Now we will see the next slide. Okay. This is the depressor anguli oris. This is the depressor muscle for the angle of the mouth. This muscle originates from the bone and the insertion to the lower lip. This muscle acts by depressing the angle of the mouth. Okay, now we will talk about the second muscle, which is the depressor. As you can see in this picture, this is the depressor labii inferioris muscle. This muscle is the depressor muscle for the lower lip. These two muscles depress the lower lip as in a frowning action. The nerve supply is by the mandibular branch of the facial nerve. This muscle also originates from the bone and the insertion into the lower lip. This is the depressor labii inferioris muscle. We will see the actions of these muscles in a short video. As you can see, this is the actions of the depressor anguli oris and the depressor labii inferioris muscle. Okay, now we will talk about the dilator muscle of the ala of the nose, which is called the dilator nares muscle. This muscle originates from the maxilla, and the insertion is to the ala of the nose. Okay, this muscle acts by dilating the anterior nasal aperture. Okay, we will see a short video about the action of this muscle, which acts by dilating the ala of the nose. Okay, as we said, the insertion into the ala and the origin from the maxilla. This is the ala, the dilation of the ala of the nose. You see in this video dilation of the ala of the nose. Okay, now we will talk about the corrugator supercilii muscle. This muscle originates from the superciliary arch, and the insertion is medially, okay, to the skin between the eyebrows. This muscle supplied by the temporal branch of the facial nerve, which supply the motor innervation to this muscle. Okay, this muscle acts by make wrinkles in the skin between the eyebrows, so it make the expression of a frowning or the frowning action. Okay, we will see also the action of this muscle in a short video later. This is the corrugator supercilii muscle. The action of this muscle is explained in this video by frowning action. Okay, make wrinkles in the skin between the eyebrows. Okay, lastly, we will talk about the zygomatics muscle, whether it is zygomatic major or zygomatic minor. These muscles originate from the zygomatic bone. Okay, while the insertion of this muscle is to the upper lip. These are dilating muscle for the lip. The nerve supply of this muscle is by zygomatic, a branch of the facial nerve, which supply the motor innervation to this muscle. Okay, the smaller one is the zygomatic minor muscle, while the largest one is the zygomatic major muscle. These two muscles dilate the lip and also make the action of smiling. This is the zygomatics group, zygomatic major and minor muscles. Also, we will see the action of this muscle now. This is the action of smiling, as you can see in this short video. Thank you all for your listening.